Welcome back, it's Dr. Somji.
And Dr. Solomon.
Today we're going to be talking about a brand that have actually chased me. It's called Eucerin. A lot of you probably know Eucerin from local pharmacies or even local skincare shops. So it's available on the counter, but it's dermatologically approved.
Yeah, that's what stands it out essentially. You have a medical grade product with a medical range available over the counter without prescription.
Yeah, and one of the chief things about why they've been chasing me is that a lot of their products can be used after certain procedures that you have in the clinic, and they're all condition focused. What I mean is that if you have kind of dark spots and sun damage, it's pigmentation. If you've got redness, they'll say they've got some rosacea solutions. So they're a little bit more medical in their focus, and they're designed to not be deconstructed skincare, but putting all the necessary ingredients together to treat a condition. So we're going to go through all the products, and we're also going to give you our opinion on it. The first product that we're going to talk about is the Hyaluronic acid filler. This is a cream that's supposed to be used at night time. Yeah. So it's in this nice container. Let's have a look and let's see how it feels for you.
Okay,
So just remember, this is hyaluronic acid. So hyaluronic acid is designed to help with moisture. So if you've got very dry skin or compromised skin barrier, using this in the nighttime is really, really good. If you're also using a retinol, you may want to layer this up over the top to help with the skin barrier and also reduce irritation.
Yeah, it certainly has a thick feel to it.
Yeah.
Very hydrating. I noticed also a bit perfumed, which I believe there is some.
Yeah, I mean, it's last on the list there. So it's probably at a very low concentration.
It's certainly noticeable.
But certainly noticeable. Again, if you've got very sensitive skin or inflammatory skin, avoiding products with perfume is really important because you might not notice the sensitivity early on. When I say early on, even within the first 6 months of a year, but repeated exposure to perfume products can create a storm in your skin.
Yeah, and I question the need for a perfume and a night product.
It's got some good things for the skin barrier. So you've got glycerin, cetearyl alcohol. So these are really like similar things that you find in like Cetaphil, Cetaphil product. You've also got pentylene glycol in there. So great things. You've got argan oil, which is great for the skin. I mean, whenever you take a trip to Morocco to the Atlas Mountains. Yeah. So, and we've got some good extracts, sodium hyaluronate in there.
So really important, and the reason why this particular cream is particularly good because it combines two factors, two functions in one. So the hyaluronic acid is a water absorber, so it draws water into it. Now without that barrier layer that also has integrated into it, you would end up sapping the skin of water. Yeah. So the water would go in one direction and be absorbed by the hyaluronic acid molecules and potentially dehydrate the skin. Hyaluronic acid is good. It's essentially a water absorber or humectant. But what we want is also a barrier, and this provides that barrier. The glycerine is there.
There's also vitamin E.
Yeah, the vitamin E as well. So that's what gives it that thickness as well. And so you're sealing in the moisture and locking it in, particularly useful at night.
It spreads nicely. Yeah. But the reason why it spreads nicely is there's also silicone in here.
Yeah.
If you layer upon layer silicone, that's going to break you out eventually. And also silicone is really bad for the environment. So it will affect aquatic animals and things. It builds up into the oceans, which is terrible. So we really need to stop doing that because there's plenty of other fatty acids that you can use to help products glide. The only other thing that I would really say is that I'm not a fan of these type of containers, mainly because it's not hygienic. I understand the need for a jar at night, but you've got like little push buttons now that preserve the contents are air jars. Yeah, rather than air pumps. You've got air jars, which can really be used. So if you want that slightly more luxury feel for a nighttime, that's probably a better way of making sure that the actives within the skincare remain sterile, but also effective.
Well, we must factor in the costs as well. Creating an air jar is more expensive.
I know the costs, and there are a lot. The next product that really caught my eye is this SPF 100, because we always talk about SPF. And really, as a basis, you only really want to be using SPF 30 because a lot of people use SPF 50 and just put it on once daily, but you can layer SPF 30 a lot easier and you'll actually have more protection. There's a difference between 95% at SPF 30 of blocking UVA and UVB rays and 97.5 at 50. But SPF 100, that's a pretty bold claim. It's a fluid, so it tells us that probably it might glide on quite nicely and not leave a white cast. But it says it helps prevent actinic keratosis and non-melanoma skin cancer. adjunctive treatment of actinic keratosis. So what is actinic keratosis?
Well, actinic keratosis is a dysplasia of cells as a result of usually sun damage and certain genetic code errors in the skin. So essentially what happens, it's a pre-cancerous change. It's not cancer, but it can cause cancerous changes in the skin. Dysplasia is a change of one cell form to another cell form that can be a precursor to cancers. And that's what actinic keratosis is.
So this is a bold claim.
It's a bold claim, but the keratosis is that keratin layer. So to break that down, and including the non-melanoma skin cancers, what you want to do, you want to ablate it chemically. And the chemical that
you want to burn it away.
You want to burn it away, and the best way to do it, just like you would do with warts, you'd usually use something like a salicylic acid. And so we're looking for that in here. And in fact, in the ingredients, you can see that there is a salicylate.
Oh yeah, there is. There's ethyl hexyl salicylate there.
Yeah. So and it needs to be of a sufficient concentration that you'd be able to use it daily, and it'd be safe on the skin, but at the same time working to slowly break that down, break down the actinic keratosis, or break down the cells.
I mean, I've got to say, for an SPF 100, just putting it on my skin, that absorbs super quickly.
Yeah.
It's pretty impressive.
So you have the SPF whilst at the same time treating the actinic keratosis. You see, as you might have relatives who have the actinic keratosis on their scalp or on their face.
Yeah.
So a great way to both protect your skin from the sun and also to treat the existing skin lesion.
I mean, there's a few things that are obviously worth noting. Obviously, it's got denatured alcohol in there, which probably doesn't really need to be in there because, again, that can cause some inflammatory conditions to your skin and sensitivity with repeated exposure. But just note that obviously it tends to be the last thing that's put on the skin. So if you've layered up, then it might not be so much of an issue for you. Obviously, it's treating those actinic keratosis with the salicylic acid, like you mentioned. And they've definitely got the titanium dioxide in there.
So titanium dioxide reflects UV, it reflects light. So what you are...
Got this like mirror-like quality.
Yeah, think of it like mirror, almost like beads in the skin, reflecting the light. And it's predominantly, you see it in mineral SPF, mineral block SPFs, and it doesn't get absorbed into the skin at the same time. So it's a non-toxic way of reflecting the UV light and protecting the skin that way.
There are definitely things that help spread it well. The hydrogenated rapeseed oil, I think, is a really good idea to include. There is silicone in there, otherwise it wouldn't spread so nicely. And then you've got Chondrus crispus extract, which is in a lot of skincare that's formulated in like Northern America, especially Florida. They love Chondrus crispus extract. It's great for the skin barrier. Also helps produce collagen in certain studies as well. So it's a nice idea of SPF. I've never seen that before. I think it's really cool for people that are prone to kind of those actinic keratosis and dark marks, with repeated sun exposure. So if you live somewhere really hot, this is something that you might want to think about.
And the next one we have is the Calming Urea Mild Shampoo. And interestingly, that has 5% urea lactate and polydecanol. Tell us about that, what you would use this for and whether you have used it.
I mean, I'm trying to look at the ingredients on our list, but I'm going to have to read it. But this is something, if you've got a sensitive scalp and seborrheic dermatitis, so if you've got kind of flakes within the scalp, this is something that's going to be really quite nice. Sometimes seborrheic dermatitis is quite painful and it can be quite sore. So you need something that's a lot more soothing. So it's really nice that they brought out a shampoo like this because, again, I haven't seen this before. With 5% urea lactate in there, that's actually pretty good to help reduce the flakiness, but at the same time soothing the skin. Obviously, you've got three main ingredients here when you're looking at the ingredients list. You've got urea, which acts as a humectant, so increases moisturizing, but also a moisturizer as well. So it's a 2-in-1 urea, which is actually a good inclusion for the scalp. You've got lactate, which is obviously going to decrease the amount of redness and sensitivity within the scalp. And interestingly, the polydecanol is something that I think probably should be included a lot more for even skin and scalp problems, because if you're sore, this acts as a natural anesthetic. So it will just soothe an irritated scalp. So if you're really kind of like a little bit burning scalp or itching and it's maybe even kind of a lot more red, then using this and letting it allow to maybe soak in for like 2 or 3 minutes when you're in the shower is really going to help those symptoms. So this is a nice product for anyone with kind of dry, itchy, inflamed scalp. This is something that you should be using.
Particularly in the winter.
Okay, the next one is actually really popular with patients, is the Mell Water. So it's a 3-in-1.
Tell me exactly what it is about Mell Water that gives it its properties. And
You've got literally little bubbles called micelles, and they're really quite clever because they act almost like soap, or temporary soap, to help bind dirt, oil, debris,
almost
makeup.
like a detergent.
almost like a detergent that's basically going to cleanse the skin, dissolves these impurities. It doesn't technically need to be washed off. If you see micellar water in action and you're not washing your face after using micellar water, you're probably going to still have some like half dissolved impurities on the skin. So it's really important to use a micellar water that's not too astringent, that helps with the skin barrier. So we're going to look to see these things in the product, but also definitely cleanse afterwards. Don't make that mistake. So let's have a look at the skincare ingredients. So we've got aqua, so it's mainly water-based, which most micellar waters are. It's got sodium hyaluronic in there and glycerin. So those are two great things. So when you use this on your face, this is not going to dry out the skin.
Yeah, and it'll glide quite nicely over the skin, especially with the addition of glycerin there.
Yeah, I mean, there's not really many other actives involved over here, but the hyaluronic acid is quite nice and it prevents things from drying out. It's suitable for sensitive skin, and actually, yeah, there doesn't appear to be any perfume in this one, which is great, but it still smells, it smells nice and fresh and quite clean. And it's also pretty cool because it's a 97% recycled bottle, so they're being environmentally conscious. I like this range. It's nice and clean, clear. I do like the packaging. It's really cool. It's just very simple. It's very, very nice. And again, it's a 97% recycled bottle. And this is a hyaluronic acid-based cleanser. So it says from normal to combination skin, which basically is for most people. And I would even go as far as saying, if you do have dry skin, you could probably use this too as well.
So it's clean, it avoids the use of any sort of harsh acids.
Yeah, and there's no acids, there's no acids in there. You've just really kind of cleansed it quite nicely. So this could be a double cleanse routine. Use the micellar water first and then use this cleanser afterwards. And actually, you know, I used it for about a week or so and absolutely fine. I didn't get any impaired skin barrier or anything.
It's worth mentioning when you said there are no acids, hyaluronic acid is not the acids that we talk about.
Exactly, it's not an AHA, it's not a BHA, it's not a PHA.
Yeah. And then we have a second cleanser for slightly oilier skin. You might get dry skin, you may potentially be very sort of inflamed and itchy. You'd want to use this after, let's say, micellar water, or potentially on its own as well.
Yeah.
For oilier skin.
I mean, look, we're looking for ingredients such as maybe salicylic acid in there to decrease the oil production. But at the same time, because it might be a little bit stripping to the barrier, we are looking for things like glycerin in there and hyaluronic acid. So let's see what we find out. So we've got aqua in there. We've actually got citric acid and salicylic acid.
There we go.
So there we go. We've got that there. Not too much for the skin barrier, to be quite honest with you. So this could actually be quite, let's say, a little bit stronger. It's got a soap-free formula with 6% amphotenicide, which is a little bit more gentler on the skin. So this is the reason why they probably haven't had those things, those ingredients such as glycerin to help with the barrier. But this is definitely for someone with really oily, acne-prone skin. But I don't think it's going to strip the skin barrier. I haven't used it because I don't have the oily skin type, but I would just exercise some caution and see if you're okay with it after a couple of weeks of use. So maybe just use it maybe 3 or 4 times a week first, and then upgrade to using it once or twice a day.
Carrying on with the cleansers and shampoos, shower lotions and gels.
So traditionally, there's a lot of controversy about using cleansers in the shower. Like, as long as the shower's not too hot, it's fine to use it in the shower. This is the Eucerin shower foam. It also says it's got a soothing scent, which is basically code for it has perfume in it.
Yeah, which I'm not a fan of, as you know.
Yeah, I mean, we're both not fans of perfume, but this has obviously got that scent there. Which, let's just,
try it,
okay, yeah, cool.
I'm very keen to. I've got a very sharp, yeah.
You got a keen sense of smell.
I do have a keen sense of smell, and it's very similar to the barrier cream that we used earlier. Yeah, it does feel like a cleansing product. It feels like a sort of...
But it's quite smooth, and definitely it's got some glycerin and things for the skin barrier in there.
Anytime there's a gliding effect on the skin, you know there's some glycerin in that.
Yeah.
And that's a good ingredient.
There is glycerin in there. Yeah. Thank God.
There's glycerin, and there's certainly, is there perfume in there? There must be.
There's perfume in there, yeah, definitely.
Again, I question the need for the perfume other than the...
I mean, literally, this is just a foam. There's just glycerin in here and perfume. And that's basically it.
So when would you use this?
If you've got dry skin. So if you've got impaired skin and you feel like when you go in the shower, your skin gets a lot more drier, you would use this. But if you've got dry, sensitive skin, then you might not want to use this because it can probably make the inflammation a lot more worse because of the presence of the perfume in there. So repeated exposure, again, is going to cause a problem. But it's a nice idea. It really is. It's a good idea of a product. next product is the Hyaluron Filler 3 times effect Vitamin C Booster.
Okay, so this is Hyaluron filler with vitamin C.
Yeah, so it's hyaluronic acid, vitamin C. It's something that we recommend all the time. What are the benefits of vitamin C?
Most importantly, it's an antioxidant effect. So the vitamin C is one of the most powerful antioxidants available, and particularly on the skin, it'll help repel the damage caused by UV light, by pollutants, external factors, and also just gives the skin a nice glow.
Yeah, so look, the first thing that we look at with vitamin C is look at the packaging, because vitamin C, especially what's in this product, this type of vitamin C called ascorbic acid, it's highly volatile. That basically means that it's just even a small amount of air is gonna basically make it from an antioxidant to an oxidant and actually cause oxidative damage. So most vitamin C that are in like jars, pots, there's pipettes, they're not really going to be stable for very long. So you want it airtight. So this is definitely an airtight container, and it's also got a pretty cool like dosing mechanism here at the back, which I think is really cool.
So it keeps it airtight and also keeps it measured. Explain to me why vitamin C needs to be protected from UV light.
Needs to protect it from UV light, but also air too. So where it's an antioxidant, it will get affected by the oxygen. And if you add oxygen onto a chemical structure, it causes something called oxidative stress, which essentially is damage to the skin. So you'll end up with redness, irritation, all sorts of problems that you are actually using the vitamin C for in the first place. And a lot of people do not know that. So when you go on the counter and you see, well, why is this vitamin C 150 pounds and why is this one 20? All to do with quality of the vitamin C, stability, packaging, all of these things increase the cost. But at this cost price, to have this innovative packaging is a real winner, and they gotta be congratulated for that. Do you want to try it?
I'll give it a go.
So again, there appears to be a fragrance in here. It's a milky texture that spreads very quickly. It's got a lot of shine on it though, definitely a lot of shine. But it can act as a moisturizer as well, because you've got the hyaluronic acid in there.
So what layer would you put this on?
I mean, you'd put this on if you don't really have time. So you cleanse your skin, you want to put a moisturizer in and the active on the skin in AM, you'd want to put that on straight away. Let that sink in and then put your SPF on top.
Yeah.
So you really can't, this is not deconstructed skincare, you can't layer it.
Whereas if you just had a vitamin C serum, you would put that as one of your base layers, and then you would put the barrier on top, but this offers you sort of combined.
You've got some good ingredients starting up. It's a water-based formulation, ascorbic acid. We don't know what the percentage is, but it seems a little bit more milder because it's designed for sensitive skin types. But yes, you've got glycerin in there, which is fantastic for the skin barrier like you talked about. You've also got squalane in there, which is one of our favorite ingredients. And that's fantastic for the skin barrier. It really helps kind of repair the skin barrier, but it's definitely not comedogenic, so it's not going to break you out. So if you've got acne prone skin and you want to use a vitamin C, this might be the one for you. And then as we move down, you've got a few root extracts in there. You've got the sodium hyaluronate, which is the hyaluronic acid. You've got silicone in there, which is a little bit annoying for, as I always say on this channel, you know the reasons by now. One of the things that I noticed with this, using it for a few days, it did sting. And in fact, when I'm using it on my skin right now, I am stinging a little bit. So, you know, maybe it's not as much of a stable formula. If you've got slightly sensitive skin, I probably wouldn't recommend it too much. If you've got a damaged skin barrier, probably you would want to use some of the other products first, including the hero product of this range that we're going to talk about next. You guys are ready for it. This is the hero product in the range. It's something that we both use in everyday life.
Everyday practice.
It's actually on my lips at the moment. So dry chapped lips, post laser, healing balm, best healing balm, better than Vaseline. It's Aquaform.
Personally, I use it for dry chapped lips, particularly in the winter. But after treatments in clinic, particularly I use it after lasers. Lasers and certain radiofrequency treatments when the skin barrier has been broken and the skin's very inflamed. It's the perfect...
So literally when someone's bleeding, post-ablative laser, you put it on.
As a barrier layer, it's protective, and also seals in the moisture, so you don't continue to lose moisture. Particularly when you do lasers, you lose that protective barrier. The purpose of lasers is to ablate the skin, ablate the top layer of the skin. When I do use that, I like that ointment. It's very well tolerated and it calms the skin down as well.
So obviously on the pack, it says do not use on open bleeding or wet wounds. So obviously you have to be guided by your clinician to do this. This is part of medical protocols that we have in our skin.
Yeah, remember the bleeding from lasers and from microneedling treatments are small pores in the skin create as opposed to open wounds. And they seal up very, very quickly. And part of the reason we use it is to help that sealing.
So you want to be really using this in many different ways. So you can definitely use this post-treatment, or if you've got very dry skin or chapped or kind of knuckles that are really
this happens
dry,
to me every winter.
And you can also use this in slugging. We've done various slugging videos where me and Hinu have already talked about why Aquaform is a little bit better than Vaseline, so she'll go through things. So if you're using Vaseline, I would always say Aquaform is an upgrade of it. It's not necessarily so much more expensive in price either. It's definitely got the advantage of glycerin, panthenol, bisabolol, lanolin, which are great to help heal skin.
Yeah, there's a really important factor as well with Aquaform versus standard Vaseline is that it does have an antiseptic effects as well, and that's particularly important post-procedure. So you do get that benefit of the antiseptic component. But there is another version.
This is something that I was really surprised about. I did not know existed until now, because before, you know, you get a pot of Aquaform, this for your balm or whatever, and you know, you have to spread it out and all that sort of thing, but you really want to be using it on the body and not being like, let's say, sticky or like feeling a bit disgusting when you're putting something very thick on. So you've got this.
So great. It feels almost like a sort of sun oil.
Yeah, but it's a spray version of the Aquaform, which is really, really cool. So say if you've got really kind of dry, sensitive skin, it's winter time, or if you've been naughty and you've been going out and burning your skin, this is great. It's a spray version of Aquaform, which is amazing.
It's amazing because you can
put this on your heels, if you've got cracked heels. You can put it on the elbows, you can put it back of neck, anywhere where you've got dry, compromised skin.
And it offers the advantage of putting on a very thin layer, so you don't potentially build up that thick, sticky layer that could potentially, you know, get absorbed into clothing.
Yeah, it's amazing.
Yeah.
So look, this is a hero product. I would recommend this in your slugging routine, in patients with very dry skin, body areas, post-shower. You can easily put this on with no problems whatsoever.
And then there's another hero product. Probably the granddaddy of them all, really.
Yeah, it's the most innovative product. So you'll see on TikTok, keratosis Polaris. So there's chicken skin formations. We've done some TikTok videos on it. And people are like, what can I use? I want to use the CeraVe salicylic acid wash and all that sort of stuff. Yeah, it helps, but not properly. You want something, a formulation with urea in there that helps reduce the appearance. And guess what?
We have the Urea Repair Plus, which is 10% urea, the highest urea you can get to our knowledge on a non-prescription.
Yeah, absolutely. And you tried this on a couple of patients.
I have,
right?
yeah. I've had a few patients actually with keratosis Polaris, as we commonly see in clinic, and I've tried it, you know, over 2 to 3 months. The remarkable results that you can get because of the urea and because of the sort of hydrating component as well and the barrier protection. But with anyone you might know who has very, very dry skin, or in fact a condition like keratosis Polaris, it can be quite debilitating. Yeah. It can be quite unsightly. It can really dent your confidence. Wearing short sleeves, but also it can be uncomfortable. It
can itch slightly.
It can itch, and it can sort of be quite irritating with certain clothing as well.
Yeah, and this guarantees immediate release within 48 hours.
Yes.
You do want to shake it because I find that the formulation separates a little bit, but it is actually really quite nice.
It's very easy to spread and very well tolerated generally as well. So I've used it on elbows and I've used it on knees. And I found that it really does make a difference. But the key with this is consistency. Don't expect 1 or 2 applications to make a difference. You need to be consistent because urea is very slow acting in its effect.
They've got some more ceramides in here, which are great. You've got a specific formula with urea and natural moisturizing factors, which are all great to help with the skin barrier. But the reason why it doesn't feel sticky is that it's in an oil emulsion.
Yeah, which is why you need to give it a shake beforehand.
Which is why you need to give it a shake beforehand. So it's got the essential ceramides in there, parky butter in there, all of kind of nice things within the formulation. So if if you're looking at keratosis Polaris and you use things like CeraVe salicylic acid based stuff, which sometimes I feel like irritates people with keratosis Polaris, irritates me actually a little bit. I find it too strong. This is actually going to be a better use. then there's aforementioned products. That's a quick review of the Eucerin range. I know they've got so many different products within the range.
And it can be quite intimidating.
It's quite intimidating, but we've just gone on and started there. There's things on pigmentation, things on redness that we're going to do in other videos. If you've got any other specific products that you want us to talk about, just let us know in the comments below. Click that link, that bell, and subscribe. You'll know about all the latest videos that we're releasing.